Hello, everyone. I am Dr. Jessica Larson, an internal medicine specialist, and I am so excited to work with you tonight on Vet Candy's NAVLE Prep. Let me tell you a little bit about my background. So I went to vet school at the University of Tennessee. After graduation, I completed a rotating internship at a private practice in Michigan outside Detroit. And then I went on to do a residency in internal medicine at Michigan State University. Currently, I own my own consulting business, providing hybrid internal medicine specialty care, endoscopy, and teaching. I've been in many settings in my career, including private specialty practice for about 10 years, industry, and mobile specialty. I remember studying and taking the NAVLE before Thanksgiving break, and I was on the equine ambulatory rotation. I kept getting called out to farms with the team, making me stress out about the test. But it all worked out in the end, and I am here to help you now. First, I'm going to go over some diseases of the hemic and lymphatic system today. If you have any questions for me, just post them in the chat and we will answer them for you. So let's get started. First up, disseminated intravascular coagulation, or DIC. DIC is a complex disorder involving widespread activation of the coagulation cascade. This leads to formations of small blood clots throughout the body's small blood vessels. This can result in multiple organ damage and severe bleeding. There are a number of risk factors, including conditions like sepsis, severe trauma, cancer, heat stroke is a big one. We used to see that a lot in Florida, and pancreatitis. All of these can be factors that trigger DIC. Clinical signs can be difficult or challenging sometimes in sick cases, and the symptoms can vary, but often include bleeding, unexpected bleedings causing petechia and ecchymosis, lethargy, respiratory distress, and often signs of organ dysfunction, which primarily you'll pick up on lab work with very sudden elevations, particularly in liver and kidney numbers. Diagnostics are often based on the clinical signs and laboratory testing, which include a complete CBC, coagulation profiles, PT and APTT, D-dimer if available, and fibrinogen levels. Schistocytes may be seen on blood smear evaluation. Treatment often includes managing and addressing the underlying cause, if identified, providing intensive supportive care, and possibly blood products, including fresh frozen plasma. Anticoagulants such as heparin may be used in some cases. Now let's look at a case. A 7-year-old German Shepherd is presented to your clinic with a history of recent trauma after being hit by a car. The dog exhibits lethargy, petechia on the gums, and spontaneous bleeding from the nose. Blood work reveals thrombocytopenia, prolonged PT and PTT, an elevated D-dimer, and decreased fibrinogen levels. What is the most appropriate initial step in managing this patient's condition? A, start the dog on high-dose steroids. B, administer intravenous fluids and fresh frozen plasma. C, prescribe oral anticoagulants. D, perform an emergency splenectomy. E, initiate broad-spectrum antibiotics. Okay, everyone, so let me know what you think the answer is in the chat below. So the correct answer is B, administer intravenous fluids and fresh frozen plasma. This is the correct answer because as the dog is likely suffering from DIC, which requires supportive care, including fluid therapy to maintain perfusion and fresh frozen plasma to replace clotting factors and stabilize the coagulation system. Let's look at the incorrect answers. A, start the dog on high-dose steroids. Corticosteroids are not indicated for DIC as they do not address the underlying coagulopathy and may exacerbate bleeding and other testing or supportive care that you need to provide down the road. C, prescribe oral anticoagulants. Anticoagulants can worsen bleeding, which is not what we need, and are contraindicated in DIC. D, perform an emergency splenectomy. There is no indication for splenectomy in managing DIC. The focus should be on stabilizing the coagulation system. E, initiate broad-spectrum antibiotics. While antibiotics may be necessary if there is an underlying infection, they do not address the primary cause of DIC. Next up, canine juvenile cellulitis, also known as puppy strangles. This is an uncommon condition affecting puppies, characterized by acute inflammation of the skin and subcutaneous tissue, particularly around the face. Risk factors include puppies aged 3 weeks to 4 months or so. Breeds such as golden retrievers, dachshunds, and Gordon setters may be predisposed. Symptoms really often include unusual swelling, pustules, and crusts around the face, muzzle, and ears. Lymphadenopathy and systemic signs such as fever and lethargy may also occur. The diagnosis is based on clinical signs and cytology of the skin lesions revealing pyogranulomatous inflammation. Bacterial culture is usually negative. Treatment does involve systemic corticosteroids to reduce inflammation in this case, and antibiotics are used if secondary bacterial infections are in fact present, generally proven by culture. Now let's look at a case. A 10-week-old golden retriever puppy is presented with swelling and pustules around the muzzle, eyelids, and ears. The puppy has a fever and is lethargic. Cytology of the lesion shows pyogranulomatous inflammation. Which treatment plan is most appropriate? A, administer high-dose corticosteroids and antibiotics. B, perform surgical debridement of the lesions. C, start antifungal therapy. D, prescribe a topical antibiotic cream. E, initiate a hypoallergenic diet. So again, let me know your thoughts in the chat for which answer you think is correct. Okay, so the correct answer is A, administer high-dose corticosteroids and antibiotics. So this is the correct treatment for canine juvenile cellulitis or puppy strangles because it responds well to corticosteroids to reduce inflammation, and antibiotics are necessary to prevent secondary bacterial infection. Choice B, perform surgical debridement of the lesions, is incorrect because surgical intervention is not necessary and could actually cause further trauma to the affected areas, generally on the face and ears. Choice C, start antifungal therapy, is also incorrect because canine juvenile cellulitis is not a fungal infection, so antifungal therapy would not be effective. Choice D, prescribe a topical antibiotic cream, is also incorrect. Topical treatment alone is insufficient for managing systemic signs and the extent of this condition. Choice E, initiate a hypoallergenic diet, is incorrect because there is no evidence that dietary changes affect the course of juvenile cellulitis. Next up, coagulopathies. Coagulopathies are disorders of the blood's ability to coagulate, leading to excessive bleeding or lack of clotting. There are several risk factors. They can be inherited, including hemophilia A and B, or von Willebrand disease, or acquired, specifically vitamin K deficiency due to rodenticide toxicity. Hemophilia A, or factor VIII deficiency, is the most common inherited bleeding disorder in dogs. Hemophilia B, or factor IX deficiency, is less common than hemophilia A. Von Willebrand disease is caused by a defective or deficient von Willebrand's factor, which is the protein that carries an important clotting factor, factor VIII, in the blood and that regulates the first step in clot formation. It is the most common inherited bleeding disorder in dogs and occurs in nearly all breeds and in mixed breeds. 3 types of von Willebrand disease are identified. Acquired disorders, such as anticoagulant rodenticides, mechanistically inhibit vitamin K, which is crucial in the recycling and production of vitamin K1, a necessary component for clotting factors 2, 7, 9, and 10. Clinical signs often include spontaneous bleeding from the gums and the nose, prolonged bleeding from wounds or trauma, and hematomas. Diagnostic tests include CBC, coagulation profiles, specific factor assays, and platelet function tests. Treatment depends on the cause and may include blood transfusions, vitamin K administration, or specific clotting factor replacements. Now let's look at a case. A 3-year-old male dachshund presents with spontaneous bleeding from the gums and prolonged bleeding after minor cuts. Coagulation profiles reveal prolonged PT and PTT, but a normal platelet count. What is the most likely underlying condition and the appropriate treatment? A. Hemophilia A, administer factor VIII concentrate. B. Von Willebrand disease, administer desmopressin. C. Vitamin K deficiency, administer vitamin K1. D. Thrombocytopenia, transfuse platelets. E. Immune-mediated thrombocytopenia, administer corticosteroids. So again, let me know your thoughts in the chat. So the correct answer is A, hemophilia A, administer factor VIII concentrate. The presentation and coagulation profile suggests a deficiency in factor VIII, which is characteristic of hemophilia A, and we know it's the most common inherited disorder in dogs. Treatment involves administering factor VIII concentrate. Let's look at the incorrect answers. Choice B, von Willebrand disease, administer desmopressin, is incorrect because while von Willebrand disease can cause bleeding, it typically affects platelet function rather than prolonging PT and PTT significantly. Choice C, vitamin K deficiency, administer vitamin K1, is incorrect because vitamin K deficiency usually presents with a prolonged PT more than PTT and is associated with conditions like rodenticide toxicity, which wasn't in this dog's history. Choice D, thrombocytopenia, transfuse platelets, is incorrect because we know the platelet count is normal, so thrombocytopenia is not the cause. Choice E, immune-mediated thrombocytopenia, administer corticosteroids, is incorrect because again, the platelet count is normal, ruling out thrombocytopenia. Next up, immune-mediated diseases. These diseases can occur when the immune system attacks the body's own cells. Examples include immune-mediated hemolytic anemia, or IMHA, and immune-mediated thrombocytopenia, or IMTP. There are several risk factors, including genetic predisposition, certain infections, certain drugs, and certain cancers or neoplasia can trigger. Clinical signs can vary between each condition. IMHA signs include pale mucous membranes, jaundice or icterus, and lethargy. IMTP signs generally include petechia, ecchymosis, and bleeding elsewhere in the body. Diagnosis of each of these conditions involves CBC, a direct Coombs test for IMHA, platelet counts, and sometimes bone marrow examination. Treatment generally involves immunosuppressive therapy with corticosteroids and other immunosuppressants as the mainstay of treatment. Supportive care and treatment of underlying conditions are also essential. Treatment involves immunosuppressive therapy with corticosteroids and other immunosuppressants, generally as the mainstay of treatment. Supportive care and treatment of underlying triggers are also essential. Some of these cases can respond quickly and favorably to treatment. Other cases are very challenging or even refractory and require prolonged hospitalization. So let's look at a case. A 5-year-old female Cocker Spaniel presents with lethargy, jaundice, and pale mucous membranes. Blood work shows severe anemia with spherocytes and a positive Coombs test. Which is the best initial treatment approach? A. Administer broad-spectrum antibiotics. B. Start immunosuppressive therapy with corticosteroid. C. Transfuse packed red blood cells and administer corticosteroid. D. Initiate chemotherapy. E. Perform a splenectomy. Drop me an answer in the chat. Okay, the correct answer is C. Transfuse packed red blood cells and administer corticosteroid. This combination addresses both the severe anemia requiring immediate correction with the transfusion and the immune-mediated destruction of the red blood cells requiring immunosuppressive therapy. Choice A, administer broad-spectrum antibiotics, is incorrect because there's no indication of infection. The primary issue is the immune-mediated hemolysis. Choice B, start immunosuppressive therapy with corticosteroid, is incorrect because whilst corticosteroids are needed, the severe anemia in this case requires the immediate correction with a blood transfusion. Choice D, initiate chemotherapy, is incorrect because chemotherapy is not indicated for IMHA. Choice E, perform a splenectomy, is incorrect because splenectomy is not the first-line treatment and is reserved for refractory cases. And next, lymphoma and leukemia. These are cancers of the lymphatic and blood-forming tissues. Lymphoma involves lymphoid tissues, while leukemia involves the bone marrow and blood. That is an important distinction that can sometimes be a tripping factor. So lymphoma is in solid tissues like lymph nodes, and leukemia is in the circulating blood. So we can often see those abnormal cells on blood smears. Risk factors include genetic factors, certain viruses, and environmental factors that could contribute to development. Clinical signs of lymphoma often include lymphadenopathy, weight loss, and lethargy. Leukemia signs can include anemia, infection, and bleeding tendencies. The diagnosis usually involves a CBC, cytology or histopathology of lymph nodes or bone marrow, and imaging studies, including X-rays and ultrasound. Chemotherapy is the primary treatment for both lymphoma and leukemia. The prognosis varies and depends on the type and stage of the disease. Let's look at a case. A 6-year-old boxer presents with generalized lymphadenopathy, weight loss, and lethargy. A fine needle aspirate of the lymph node reveals a population of large atypical lymphocytes. What is the most appropriate next step? A, administer broad-spectrum antibiotic. B, start corticosteroid therapy. C, initiate chemotherapy. D, perform a lymph node excisional biopsy. E, prescribe anti-inflammatory medication. Again, let me know your thoughts in the chat. Okay, so the correct answer is C, initiate chemotherapy. The findings are consistent with lymphoma, and chemotherapy is the standard treatment to induce remission and prolong survival. Choice A, administer broad-spectrum antibiotics, is incorrect because antibiotics are not effective against lymphoma or leukemia. Choice B, start corticosteroid therapy, is incorrect because while corticosteroids can be part of the treatment, chemotherapy is necessary for comprehensive management. Choice D, perform a lymph node excisional biopsy is incorrect because often a fine needle aspiration can provide a definitive diagnosis, which means excisional biopsy or removing the entire lymph node is unnecessary. Choice E, prescribe anti-inflammatory medication is incorrect because anti-inflammatory medications do not address the underlying neoplastic condition. This is one of the only conditions in which a simple test, while the pet is awake or lightly sedated, can give a definitive answer without a more intensive workup. And last up, systemic lupus erythematosus, or SLE. SLE is a multi-system autoimmune disease where the immune system attacks various organs and tissues. Risk factors include genetic predisposition and some environmental triggers. Breeds, such as German Shepherds and Collies, are predisposed. Clinical signs can vary widely and can include fever, joint pain, skin lesions, and kidney disease. The diagnosis is based on clinical signs, anti-nuclear antibody testing, or an ANA test, and biopsy of affected tissues. Treatment involves immunosuppressive drugs, primarily corticosteroid, and the management of affected organs is also crucial. Now let's go to our last case for tonight. A 4-year-old female collie presents with polyarthritis, a butterfly-shaped rash on her face, and intermittent fever. Laboratory tests show positive anti-nuclear antibodies, or the ANA test, and proteinuria. What is the best treatment approach for this dog? A, administer non-steroidal anti-inflammatory drugs, or NSAIDs. B, start immunosuppressive therapy with corticosteroid and azathioprine. C, prescribe antibiotics for the fever. D, initiate antifungal therapy. E, recommend surgical intervention. Last one, let me know your thoughts in the chat. The correct answer is B, start immunosuppressive therapy with corticosteroid and azathioprine. This presentation is consistent with SLE, which requires immunosuppressive therapy to control the autoimmune response. Choice A, administer non-steroidal anti-inflammatory drugs, is incorrect because NSAIDs alone are insufficient for treating SLE. Choice C, prescribe antibiotics for the fever, is incorrect because the fever is due to an autoimmune response or systemic inflammatory response and not infection, which is important to distinguish. Choice D, initiate antifungal therapy, is incorrect because there is no indication of a fungal infection. Choice E, recommend surgical intervention, is incorrect because surgery is not appropriate for managing SLE. Azathioprine is also a human drug used in the treatment of autoimmune diseases. It works differently than steroid and allows a combination treatment to decrease the dose of steroid over time, thereby minimizing side effects. That's all for tonight's episode of Vet Candy's NAVLE Prep. I hope you enjoyed our conversation and found it helpful for your studies. If you have any questions, be sure to drop them in the chat. Good luck on your test. Bye.